Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Niken Anisa Maharani from Diplometry Medical Technology Laboratory Medic Study Program. My ID number is P07134122078. Today, I will explain about high HP or AIDS. High HP or AIDS. High HP stand for Human Immunodeficiency. Salah lagi, sorry. Ya gitu aja. High HP or AIDS. High HP stand for Human Immunodeficiency virus, and it attacks immune cell called CD4 cells. These are types of T cells, white blood cells that circulate around the body, detecting infection and faults and anomalies in other cells. High HP targets and infiltrates CD4 cells, using them to create more copies of the virus. In doing so, it destroys the cell and reduces the body's ability to combat other infections and diseases. This increases the risk and impact of opportunistic infection and some types of cancer. However, it is worth noting that some people have high HP for long periods without experiencing any symptoms. High HP is a lifelong condition, but the treatments and current strategies can prevent the virus from transmitting and the disease from progressing. AIDS stands for Acquired Immunodeficiency Syndrome. It is an advanced stage of HIV. Doctors identify AIDS as having a CD4 count of fewer than 2,000 cells per cubic millimeter. They may also diagnose AIDS if a person has characteristic opportunistic infection, associated types of cancer, or both. When a person with high HP does not receive treatment, the immune system gradually wears down, likely leading to stage 3 high HP. However, advances in antiretroviral treatments have made this progression increasingly less common. In 2019, trusted source, approximately 1.2 million people were living with high HP in the United States, and 15,000 people with high HP died. These deaths were due to any cause. High HP can transmit when body fluid containing the virus come into contact with a permeable barrier in the body or small breaks in moist tissues and areas, such as the genitals. Specifically, high HP can transmit via wool, semen, pre-semifinal fluid, vaginal fluids, rectal fluids, breast milk. The virus cannot transmit through saliva, so a person cannot contract high HP through open-mouthed kissing. For example, one of the main causes of high HP transmission in the US is anal or vaginal intercourse. Transmission of high HP occurs when individuals do not use barrier protection, such as a condom, during intercourse, or are not taking pre-exposure prophylaxis or PrEP, a treatment that aims to prevent high HP transmission among people with no risk factor. Sharing a cold mean for injecting drugs is another main cause of high HP transmission in the US. Less commonly, HIV transmitted to babies during pregnancy, childbirth, or breastfeeding or cheese feeding. There is also a chance of transmission through blood transfusion. The risk is extremely low when blood donation undergo effective screening. Anyone can get high HIV, but certain groups have a higher risk of getting it. 1. People who have another sexually transmitted disease or STD. Having an STD can increase your risk of getting or spreading high HIV. 2. People who inject drugs with steroid needles. 3. Gay and bisexual men, especially those who are Black or African American or Hispanic or Latino American. 3. People who engage in risky sexual behaviors such as not using condoms. The first sign of high HIV infection may be flu-like symptoms: fever, chills, rash, night sweat, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. These symptoms might come and go within 2 to 4 weeks. This stage is called acute high HIV infection. If the infection is not treated, it becomes chronic high HIV infection. Often there are no symptoms during this stage. If it's not treated, eventually the virus will weaken your body's immune system. Then the infection will progress to AIDS. This is the late stage of high HIV infection. With AIDS, your immune system is badly damaged. You can get more and more severe infection. These are known as opportunistic infection or OLS. Some people might not feeling sick during the earlier stage of HIV infection. So, the only way to know for sure whether you have HIV is to get tested. Prevention of HIV or AIDS. 1. Using condoms. 2. Ensuring that your partners who are living with HIV are taking treatments. 2. Using PrEP to prevent getting HIV if you have ongoing risks, including during pregnancy. 3. Using sterile needles and syringes for all injections. 4. Getting tested and treated for a sexually transmitted infection. How to reduce the risk of spreading HIV by 1. Do an HIV test. 2. Choose less risky sexual behavior. This includes limiting the number of sexual partners you have and using a latex condom every time you have sex. If you or your partner are allergic to latex, you can use a polyurethane condom. Be tested and treated for sexually transmitted diseases or STDs. Do not inject drugs. Talk to your healthcare provider about medicines to prevent high HIV. PrEP or pre-exposure prophylaxis is for people who don't already have high HIV but are at very high risk of getting it. PrEP is a daily medication that can reduce this risk. PAP or post-exposure prophylaxis is for people who might have been exposed to high HIV. It's only for emergency situations. PAP should be started within 72 hours of possible exposure to high HIV. If a person with high HIV not receive infection treatment, the virus weakens the body's ability to fight infection, exposing it to serious illness. When CD4 cells are severely depleted at fewer than 200 cells per cubic millimeter, a doctor can diagnose stage 3 high HIV. Certain opportunistic infection involving bacteria, virus, fungi, or mycobacteria also help a doctor identify stage 3 high HIV. Symptoms of stage 3 high HIV can include blurred vision, a dry cough, night sweat, wet spot on the tongue or mouth, shortness of breath, or dyspnea, swollen glands lasting for weeks, diarrhea, which is usually persistent or chronic, a fever of over 100 Fahrenheit, 37 Celsius that lasts for weeks, continuous fatigue, unintentional weight loss. A person with high HV stage 3 a significantly increased risk of developing a life-threatening illness. Without treatment, people with AIDS typically live for around 3 years trusted source after diagnosis. However, by taking other medication alongside high HV treatment, a person with AIDS can control, prevent, and treat serious complications. When a person with high HV takes effective treatment, the infection may never progress to stage 3. Treatment can also help a person recover some lost immune function, which will help ward off severe infection. I think enough. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.